Hi, I'm Dr. Deeke. Let's talk physical exam today. What is your veterinarian doing when they're looking at your dog or cat from head to tail? We'll go over the details with you and let you know exactly what we're looking for and what we're finding. First, we'll start at their nose. So we look at their eyes with the ophthalmoscope. We're looking here for reflexes in the eyes, any evidence of any blindness or vision abnormalities, any evidence of cataracts or abnormal issues forming in the eyes, and making sure that they see us well. Good girl, Dolly. Good girl. We also look at in their mouth. So here we're looking for dental tartar, gingivitis, any broken teeth, fractured teeth, any loose teeth, any oral cancers. So cancers can grow on the gums as well as on the tongue, under the tongue, in the rest of the oral cavity. So we'll lift up their lip, look at their front teeth, their left and their right sides, as well as opening up their mouth completely and looking in the back of their mouth and under their tongue. Good girl. Her teeth are beautiful. We also look in their ears. We're looking for any inflammation, infection, irritation, sign of allergies, any hematomas or swelling of the ears, usually due to ear infection or trauma, any excessive hair or anything that is growing that should not be. We also feel all of their lymph nodes. They have lymph nodes in their throat. They have lymph nodes in their shoulder area. They have lymph nodes in their armpits. They have lymph nodes in their groin, as well as behind their knees. Those are the major areas. We also feel all of their joints, range of motion, make sure they have good muscle mass, good mobility, no pain, no sensitivity in any of their limbs. We check all of their feet and their little toes to make sure nothing is stuck in their fur or between their paw pads. No evidence of any dermatitis or inflammation from licking or chewing. We also rotate all of their joints to make sure we don't have any crepitus or creakiness or stiffness of the joints. Make sure they have good muscle mass and mobility. Good girl, Dolly. We feel their abdomen to make sure that they're comfortable, they're not tense. We don't have any evidence of anything firm, any fluid in the abdomen, or any abnormal organs or enlarged organs. We also feel their bladder to make sure that it's nice and empty and not sensitive on palpation. Especially with cats, we make sure that that's completely empty or a normal size and not excessively large, which can be a symptom of urinary obstruction. We also look under their tail, make sure their anal glands look normal. There's nothing infection or irritation related, and there's also nothing that is stuck in their fur. We hold them up to look at their abdomen. Again, make sure there's no umbilical hernias or any abnormal mammary tumors or any lumps or bumps, any issues with their prepuce or any discharge coming out of their prepuce or their vulva. And lastly, we listen to their heart and their lungs. Here we're listening to all chambers of their heart to make sure we don't have any evidence of a heart murmur. We're also listening to their lungs to make sure that they're nice and clear, no crackles, no wheezes, no raspiness, and make sure that they breathe with normal frequency. They're not breathing too hard, too heavy, or too fast. And her heart and lungs sound great. So that's explanation in detail of our physical exams. We do them very quickly because, of course, we do them multiple times per day and we can be very efficient. But if you ever have any questions, please feel free to let us know.